Hello, this is Siddharth Amber from Chicago Arthritis and Regenerative Medicine. Welcome to our weekly live broadcast. It's July 22nd, 2020. I hope everyone is doing well out there. Before I start talking about what my topic of the discussion is today, this weekly broadcast on Wednesday is where I'm talking about clinically relevant issues that we see here at Chicago Arthritis, namely issues related to evaluation and treatment of arthritis, tendinitis, injuries, and back pain, cutting edge concepts, regenerative medicine concepts, inflammatory concepts, things that I'm interested in and concerned about, things that are relevant to my patients and clients, and how I see things professionally as well. I was thinking, if you really want to know what I want to talk about, it's I've been binge watching with my wife that Netflix show, The Matchmaker. It's such a good show, but then it occurred to me, who would want to see me talk about that? So I'm talking about imaging today. So I get a lot of questions about imaging when it comes to people's musculoskeletal issues, and imaging is one of those things that's a little bit of a mixed bag, in the sense that it offers a ton of value, but it can also create a lot of confusion, and sometimes it's not always that helpful. So some of the benefits of advanced imaging, if you have pain, dysfunction, or functional limitations, or an injury or inflammation, are, number one, that you can get a ton of detail in that kind of advanced imaging, things like MRI and ultrasound. In addition, it offers a lot of subtlety in terms of explaining pathology. I'm going to go over a few cases that kind of discusses that, because I think it's things that'll help to explain and reveal what I mean by that. The downside of imaging is that a lot of times it's not actually relevant. A lot of times you find problems that are not actually explanatory for why somebody has symptoms, and then you have to deal with that. So ideally, the way it would work is you would have a clinical evaluation, you would have a clinical suspicion for what's going on if someone's complaining of pain in XYZ, and then imaging helps to confirm that, define it, and kind of leads you in the right direction. So the way that I generally use higher level musculoskeletal imaging would be, what's my initial clinical suspicion based on how somebody's describing their symptoms, based on what their examination findings are, and based on all that, then deciding, does somebody need some additional imaging, whether that's an X-ray, MRI, or ultrasound, or CT scan, and then utilizing the imaging to help either confirm what my initial clinical diagnosis was or suspicion was, and then helping to refine treatment as well, helping to define the severity of what somebody has, helping to define whether somebody is a candidate for treatment X, Y, or Z, and then deciding perhaps what areas need to be treated or how aggressively you need to treat as well. And I'll describe some of those with examples. So, these are really just kind of examples that, while I see commonly, these are also examples from real patients that I've seen in the last week. So example one would be somebody who comes in with instability symptoms. So as an example, somebody who says, you know what, I have a lot of popping in my shoulder. Every time I do activity X, my shoulder feels like there's more pain, like it can't tolerate weight. Or, you know what, I'm able to walk comfortably, but when I go past X number of blocks, then suddenly I start to develop more pain or looseness, or it starts to feel fatigued. Those are really classic instability symptoms. And I had a case last week where somebody had some really classic instability symptoms in her neck and shoulders. And on examination, there were some findings that were indicative to suggest that she does have some instability as well. And she'd happen to have an MRI of her shoulder and her neck, and there wasn't anything significant. So how do you reconcile that? How do you reconcile somebody that has symptoms that I'm very suspicious for, and yet an advanced imaging modality like an MRI that doesn't quite fit what I would expect to see? So number one is, normally MRIs are static images, meaning they're not dynamic. You don't see somebody moving through a range of motion, flexion, extension. There are some MRI scanners that can do that, but for the mass majority of time, it's really just a joint or area that's in a fixed position, and then a static scan that's looking at that. And so the problem with that is instability doesn't show up on static scanning. On the other hand, a dynamic X-ray or dynamic ultrasound can find those kind of things. So as an example, a dynamic X-ray where you're looking at somebody's neck, where you're having them flex and extend it and seeing sort of how things are moving, that can show instability in different segments. That's very helpful. That can define instability. Ligaments are not always well viewed on MRI. You're not going to see the ligaments on X-ray, but you can at least see how the bones are shifting and moving when they're in a dynamic range of motion. Ultrasound is a really great other kind of dynamic modality for imaging. And so an example would be, let's say a shoulder. If you want to see how that looks when you move somebody through a range of motion, whether that is putting their shoulder above their head, behind their back, and then seeing how does the rotator cuff and ligaments look, how do the bones look when you're stressing some of those soft tissue structures as well. It can give you a much better sense for is there instability. So in this individual's case, on dynamic scanning, she does have evidence of instability at her mid-cervical level as well as within her shoulder. And it helps to guide us in terms of how we want to treat that, namely whether or not she's an appropriate candidate for regenerative treatment or not, to treat the specific ligaments and soft tissue structures that are likely causing the instability and pain in her case. But great example of where MRI is normal, but the dynamic scanning is helpful for instability. Another example this past week is an early rheumatoid arthritis patient. So a woman who had pretty significant symptoms a couple months ago. They've kind of calmed down a bit right now. And then we're having to decide, does she need to be on some kind of treatment, medication, or otherwise long-term? So for me, the right way to do that is let's look at the joints that are affected under ultrasound. And on that, what I can see is some very mild chronic changes, suggestive that she's had some inflammation in the past, but that there's no active inflammation right now. So in having a conversation with her, I can guide her by saying, look, you certainly have had something happening in the past. I can tell that on the ultrasound, but on ultrasound, I can also tell that it's not like a significantly active issue right now. So if we choose to pursue treatment for this in a conservative manner, then we can do that. And in her case, we're just using some over-the-counter supplements like omega-3 and turmeric and glucosamine rather than jumping the medication, because her symptoms are not only controlled, but more importantly, her ultrasound doesn't show active inflammation. The flip side to that would be another patient who hasn't been on treatment for a while and has had symptoms that are progressive. And in his case, he's got an ultrasound that shows not only chronic changes from prior inflammation, but right now he also has active inflammation. Because he's got that active inflammation, that's going to push me to give recommendations that are a bit more aggressive in terms of medication, because I know that that ultrasound finding is an indication that that's someone whose condition can progress over the next year or two, rather than being conservative right now. So utilizing advanced imaging in this case of knowing when to treat aggressively versus a wait and see approach. Wait and see is a great approach with a couple caveats. Number one is you actually have to follow up and see what's going on. You can't just sit there and do nothing about it. You actually want to see how do things progress, either symptom-wise, exam-wise, and definitely on imaging-wise as well. And ultrasound's great for that. The flip side is also wait and see doesn't mean do nothing until that follow-up point. Wait and see can also mean let's do some conservative things, whether that's having that person go through physical therapy, occupational therapy, or taking the right kind of joint healthy supplements, things that are low risk, not adding on risk long-term to their health, still treating an issue in a conservative manner so that we're not ignoring it, but still kind of giving us some time to see how this person will adapt and how their body naturally responds. So ultrasound is a great example in this case for inflammation of knowing how you can tell when to treat aggressively versus wait and see. MRI can also give you similar information as well in a very subtle fashion, very sensitive fashion, but not something that you have right at the bedside or right in the clinic, while ultrasound is, and something that can give us really great detailed information right off the bat. The last one, a shoulder case, a man who has fairly advanced shoulder osteoarthritis. I ended up treating his shoulder yesterday, actually, with a combination of utilizing his own bone marrow derived stem cells known as bone marrow aspirate concentrate, also his own adipose or fat cells that has some more cells and growth factors to help from the arthritis standpoint, and also utilizing his own platelets. So we were treating his shoulder joint, his main joint, the glenohumeral joint. I did an MRI in his case as well, not so that I could confirm that he's got arthritis, but I want to see if he has any evidence of inflammation in the bone. Helpful, because if he has inflammation in the bone, we want to treat the bone as well, injecting cells into the bone as well. The reason being that the cartilage cells in the joint lining itself does not have very good blood supply on its own, but it does get blood supply from the bone. And so if there's evidence of swelling or inflammation in the bone, that'll help to reduce, or that will reduce blood supply to the joint and the cartilage, which will then lead to more progressive damage in a faster fashion. So because that MRI was done and we can see that he has evidence of inflammation in the bone, his treatment was to treat not only the shoulder joint, but to also treat the bone itself, because he'll get a better result longer term by treating all those structures that are driving his pathology and his pain. And so a great example of how advanced imaging, while we know what his diagnosis is, shoulder arthritis, the advanced imaging helps to define the severity of pathology as well as targets that need to be treated. So overall, imaging has a ton of utility in terms of being able to help define the level of pathology, severity, treatment areas, and how aggressive you want to treat. You don't want to do imaging, or you don't want to get imaging done if it's not going to give that kind of evidence. If you're just fishing for a diagnosis, looking for one, searching for one because you're not sure what's going on, it may lead you astray and down the wrong path, because it may not give you information that's really targeted, treatable, and something you can do with. So advanced imaging, very helpful in my own practice when you utilize it in a smart and targeted fashion, and adds a lot of value to patients in terms of how we treat them as well, and something that comes up all the time, when I'm in clinic as well. Well, until next week, I hope everyone is doing well. As a reminder, we're doing a live event Monday mornings as well as Wednesday noon. The Monday morning ones are more me interacting with my own team, talking about clinical issues, patient questions, their own questions, while this one is more just about me talking about kind of bigger picture things. And until next week, I hope everyone stays healthy and well, and have a good day and live well. Bye-bye.